So I'd like to continue talking about interviews and focus groups, but this time focusing on your interview guides, what questions you're going to ask and how to develop them. So here's an example from a former student, and she was looking at how military veterans, people who have served in the military, are transitioning to college and what they might need and how they're doing. And so one of her questions was, based on an actual model, conceptual model, which allowed her to ask a question and hear what the answer was, but then probe and prompt on different things that she felt would be important to understanding their experiences. So here's an example. She asked, what people, places, services, and things have made it easy for you to become and to maintain your standing as a student at UAF? And again, this is in the context of military veterans. So she listened to the respondent's answer, and then she probed on different things if she didn't hear things that had to do with them as individuals, such as their personal motivations, their skills, or their ability to ask for help. She probed on interpersonal level facilitators, such as support from others, especially in terms of professors and family and friends. She probed on another level of the socioecological framework, this framework that we're talking about in terms of community, organizational, or environmental facilitators, such as facilities and services offered at UAF. And then she also asked about spiritual facilitators in terms of their faith, their religion, their church, their temple, other things. So the idea is that she asked this one question and let them tell their story, but then she probed on things that she knew were important from the literature, from her own biases, from just what she asked. And because she let them talk before she started probing on these specific things she was looking for, she might have found something that's not even in these probes. She might have found something that was more existential even than the factors of faith, religion, and church. So it allows her to try to find what she's looking for in terms of how people compare with what she already knows, but also keeps her open to new information. Here's another example. I was working with a doctoral student who was looking at an HPV vaccine in Alaska Native children. And she wanted to know about providers and what made it easier or hard for them to actually bring up and recommend the HPV vaccine to parents of Alaska Native children in their practices. And so initially she came up with a lot of questions, somewhat not very open-ended. So, do you routinely discuss HPV vaccine with your patients and or their parents? Yes, no. And then she would prompt them to discuss. Do you have any reservations about recommending the vaccine to girls, to boys, specific age groups? Do you feel the HPV vaccine is safe? If yes or no, why? She wanted to ask them about whether they thought it was effective. How do you respond to parents' concerns? What do you say? What do you think are the barriers? Is there anything that would help to increase vaccine rates in Alaska Native children? So these are good questions. Some of them I think would be fine on a demographic form that goes with the each participant and and then have them answer more open-ended questions. And so we really thought about, what is she getting at? What does she want to know? And so here are the questions again that she came up with, but also a revised version that really rises up from these small, minute questions to be a little more open, a little bit more in tune to listening, and then prompting for other information. So we decided that she would start with this very big, broad, open-ended question, the Grand Tour question: tell me about your practice regarding HPV vaccine. Just tell me what you want to tell me. That gives them a chance to tell their story, and then they might answer some of the questions she has that follows. So she has to listen. Then she get into what are some of the facilitators and barriers to recommending HPV vaccines to your Alaska Native patients or parents. And then she was listening for and prompting on those specific questions that she was asking that could have been yes, no answers. She was prompting on age and gender, parent factors like their concerns, limitations, guidelines of the practices, maybe the cost and accessibility of the vaccine, even the provider's concerns regarding effectiveness and safety. Then she asks, how do you address the barriers you face to recommending HPV vaccines? How do you think we can increase vaccines in Alaska Native children? And is there anything else you'd like to add? So if you look to the left, these few very open-ended questions actually cover what she asked in the on the left side, but it's more open. It's more conducive to a doctor or a provider telling the story that they need to tell so that she really gets the provider perspective, not just their answers as forced into her own response categories. Whoops. So not for Thursday, that's not supposed to be on this, but just think about how well did your interview questions help you to collect information? How did you record your responses, and what interesting or new expected things did you learn? These are all in your assignments, and they're all coming out very nicely. And so forget that this is due on Thursday, but we'll move on to talk a little bit more about focus groups in our next week's work.